Buenos dias, Zamboanga. Welcome sa PIA Kapihan na Zamboanga sa SM City Minpro. Hatid sa inyo ng Philippine Information Agency, Mindanao Communicators Network, SM City Minpro, MCTV at eMedia. We are live at PIA Western Mindanao Facebook page and other government agencies' Facebook pages, One TV Philippines, Isa TV Channel 17, PCH Cable TV, and via cable television in Zamboanga City at MCTV and eMedia. Happy Kapihan Wednesday po sa lahat ng ating mga viewers. Ang Kapihan na Zamboanga will discuss important topics that will help you make more informed decisions wherever you are. At ngayon po, pag-uusapan naman natin sa ating episode ay patungkol sa kalusugan. Pag-uusapan po natin ang ating observance of our World Tuberculosis Day. At mga kasama natin from Department of Health Region 9, ang TB or ang ating Tuberculosis Regional MedTech Coordinator. We have Sir Neo Walter Ted Folgo.
So, buenos dias. Ma'am Myra, buenos dias po sa ating mga tagapanood sa Zamboanga Peninsula.
Welcome po sa ating program, Sir Neo. Like I mentioned, pag-uusapan natin yung ating observation of World Tuberculosis Day. So, why do we observe this po, itong World Tuberculosis Day? What's the significance of observing this?
So again, the World Tuberculosis Day is observed annually on March 24th. So, it is an international event. So designed to raise awareness and about tuberculosis. So this is the day that aims to highlight global efforts to eliminate the TB control program.
What is the importance po of in raising awareness about tuberculosis? What are the key objectives po on observing World Tuberculosis Day each year? How important it is? Is it because tumataas ba yung cases natin?
So right now, the key objectives for the World Tuberculosis Day in the Philippines would likely focus on the raising awareness, to advocate yung people around the world or the Philippines to promote yung early detection natin and treatment. So it would reduce also the stigma, and advocating for increased resources, yung policy support to combat TB effectively, and of course, yung celebration natin ng success ng programa.
What are some of the major challenges naman po na face natin in combating tuberculosis globally, and how does World Tuberculosis Day contribute to addressing these challenges?
So again, TB is a preventable and curable disease, and its control is highly cost-effective health intervention. So however, yung access natin sa TB diagnosis and treatment, poor health-seeking behavior, and also, of course, associated yung mga health problems such as smoking, diabetes mellitus, and yung poverty, and worsening iniquities to continue yung spread ng TB and undermine yung control efforts natin sa program. So overall, the World Tuberculosis Day serve as a platform for collection and action of solidarity in the global fight against tuberculosis.
Pero normally, sir, we are observing this one day lang siya, So how about, syempre meron tayong mga sustainable programs, services na ginagawa from the Department of Health? Meron naman.
Yes, we have the usual natin, It's a year-round na activities to support yung programa. But this is a very special one, So that we can commemorate or yung to enjoy natin yung mga success na happen or nagawa natin sa tuberculosis program.
And syempre, speaking of success, can you share any recent advancement po or initiatives in TB prevention, diagnosis, and treatment that are being highlighted or will be discussed on World Tuberculosis Day?
So, yun Myra, So for the healthcare workers, we are more aggressive in finding the TB patients through active case findings. So we also have to have contact investigation activities. We also have scale up yung rapid TB diagnostics natin. So for diagnosis and also yung mga private practitioners natin ngayon, we have already notified them. Magre-report sila sa Department of Health. Also, we have the life-saving po na TB preventive therapy to continue yung ating pag-increase ng paggamit ng TPT drugs.
So, mas mabilis po ba yung testing natin ngayon on tuberculosis?
Yes, relatively we have faster yung ating test ng or to diagnose yung ating mga TB patients through yung machines na tinagamit na gene expert machines. So these advancements and initiatives represent ongoing efforts to strengthen TB prevention as well as yung mga diagnosis nga natin na mention. So this is more on the achievement natin sa TB epidemic to end it by 2030.
Sir Neo, syempre ito gusto rin nating ma-aware no, yung mga tao on tuberculosis. So paano ba ito nakukuha? Bakit ba nagkakaroon ng tuberculosis ang isang tao?
So ang ating TB or the tuberculosis is caused by a bacterium called tuberculosis again, no, is caused by the Mycobacterium tuberculosis. So yun yung mga main talaga na agent natin for tuberculosis. So it's a kind of bacteria na nalalanghap natin through air.
Okay, so maaari kang mahawa. Paano po nahahawa ang isang tao? Nakakahawa ba ito?
Yes, it's a very infective na disease kasi nalalanghap natin eh. It's all around us. So if we are very poorly immune, yung ating immune system natin, we can have it, no? Especially in our areas, so highly density tayo ng tuberculosis talaga.
So paano po siya maiiwasan? Do we have tips or advice para maiwasan siya?
Like all other diseases, like yung mga airborne diseases, we can use yung proper hand washing, yung typical use of yung face mask. These can prevent these kind of diseases. So basic lang yung ating paggamit, no, or yung mga preventable activities, pero it's a very big impact sa ating pag-prevent ng TB disease.
But we want to clarify po na ang TB ay nagagamot.
Of course, again, no, na-mention natin, TB is a curable disease. So may gamot po tayo ngayon, and this advancement nga na-mention natin earlier, yeah, it helps, no, faster yung treatment compared to 5 years or 10 years ago.
Sir Neo, what role do governments and healthcare organizations and communities play in raising awareness and addressing tuberculosis? Not only, yes, for World Tuberculosis Day, but all year round, every day po. Paano po natin ito, paano tayo collaborate with the organizations and the community to address tuberculosis?
So again, us in the government, no, we are the responsible person to cater to the policies and advocacy campaigns, no. We also have partners from the healthcare organizations that provide TB prevention, diagnosis and treatment services to individuals affected by TB. Again, yung awareness and education is very vital, especially in the community, no, because it will raise the awareness and combating again the stigma associated with the disease.
What are the main goals naman po and priorities in the global fight against tuberculosis? And how can World Tuberculosis Day help to advance these goals?
So ultimately, the goal of the TB program is to end the TB epidemic. So with the targets to reduce TB incidence and mortality rates by a certain percentage by 2030, no? So advocacy, again, World TB Day provides a platform for the advocacy efforts aimed at mobilizing government, policymakers, healthcare organizations, and communities to prioritize TB control efforts. So overall, no, World TB Day serves as a catalyst for collective action and solidarity in the global fight against tuberculosis.
Thank you very much. Well, lastly na lang, Sir Neo, what is our message to all the viewers natin? Give them advice, tips ba, and join them, no, in celebrating or observing our World Tuberculosis Day.
Again, no, we invite everybody to be more open and to be more accepting sa ating mga TB patients. So testing is free. You can visit us or your mga sites, facilities, so that you can be tested for the disease. So curable naman ang disease, no need to worry as long as we have the medicines, we can provide it to you. Again, let's end TB together po.
Thank you very much po. Marami po tayong natutunan from Sir Neo Walter from the Department of Health. Maraming salamat po sa pag-share sa amin ng mga importance and mga tips rin po para po maiwasan din natin or stay healthy po tayo. And of course, yung ating pag-observe din sa World Tuberculosis Day. Maraming salamat po. Once again, our guest from Department of Health Region 9, the TB Regional MedTech Coordinator, Sir Neo Walter Ted Folgo. Maraming salamat po.
Thank you, Ma'am Myra.
Siyempre, hindi pa po dyan nagtatapos yung ating pag-uusapan ngayong araw dahil pag-uusapan po natin ay patungkol po sa kalusugan. Sa ating pong pagbabalik, dahil nga po we are also celebrating the Women's Month, pahalagahan rin po natin ang kalusugan ng ating mga kababaihan. So, paano ba ito maprotektahan at paano po manatiling ligtas and healthy ang ating mga mothers, women all over the world. So, we have our guests po later on from the Department of Health pa rin po. We have Dr. Cheryl Sarmiento sa pagbabalik po yan ng Kapihan na Zamboanga.
Walang higit na puwersa kaysa isang babae na nagpupunyagi at nagtatagumpay. Sa pagdiriwang ng buwan ng kababaihan, nakikiisa ang Philippine Information Agency sa Lipunang Patas sa Bagong Pilipinas, Kakayahan ng Kababaihan, Patutunayan. Tunay na ipinamamalas ng kababaihan ang kanilang kakayahan at husay sa ating lipunan. Ang kanilang tagumpay at kontribusyon ay patunay ng kasiglahan at kaunlaran ng ating bayan. Kaya't hinihikayat namin ang lahat na maging bahagi ng pagpapalakas ng kababaihan. Bigyan natin sila ng espasyo upang ipahayag ang kanilang mga boses at maisakatuparan ang kanilang mga pangarap at layunin. Higit sa lahat, patuloy nating isulong ang patas na pagtrato at pagkakataon para sa kanila dahil ang kanilang tagumpay ay tagumpay ng buong lipunan. Sa ating pagkakaisa, patunayan natin na ang lakas ng kababaihan ay tulay sa paghubog ng isang mas maunlad, makatarungan at patas na lipunan. Mabuhay ang mga kababaihan ng Pilipinas, mabuhay ang lipunang patas at makatarungan para sa lahat. Abante, babae!
Welcome back sa Kapihan na Zamboanga. At ngayon po, pag-uusapan na po natin ang patungkol rin sa pagpapahalaga ng women's health po. Lalong-lalo na po ngayon at sinaselebrate po natin ang ating Women's Month ngayong buwan ng March. Andito pa rin po kasama natin from the Department of Health in Region 9. We have the Medical Officer po ng DOH 9. We have Dr. Cheryl Sarmiento. Doc Cheng, welcome po muli sa ating program.
Hello, Ma'am Myra, and happy National Women's Month.
Yes. Ayun, like I said, pag-uusapan natin yung welfare, well-being po ng ating mga kababaihan. So, first po, ano po yung mga pressing issues o pressing health issues po facing by women today, and how can awareness campaigns during Women's Month help address these issues?
Okay, so there are a lot of health issues and challenges faced by women nowadays, no? But we have named lang po four. One is maternal mortality. Maternal mortality in unacceptably high. Globally, in 2020, we noticed almost 800 women died from preventable causes related to pregnancy and childbirth. Every 2 minutes, a maternal death occurred last 2020 also. And almost 95% of all maternal deaths occurred in low and lower middle income countries in 2020. In the Philippines, since 2012, the MMR or maternal mortality rate also shows a very slow decline. But a sharp increase was observed in 2022. We had 144 per 100,000 live births ang nireport nating maternal mortality, no? So which is very far from our target sana na last 2022 na 90% per 100,000 live births. So what is our goal for maternal mortality? We want to reduce maternal mortality ratio to 70 per 100,000 by 2030 and consequently reduce newborn death. So our vision is for all Filipino women to actually have full access to health services towards making their pregnancy and childbirth safer. So guided by universal healthcare framework, we want to provide rational and responsive policy direction to LGUs, to our partners, in the delivery of quality maternal and newborn health services. So when we say we want access to quality care and safer pregnancy and delivery, we look at various indicators like ANC, antenatal care, facility-based delivery, and postnatal care. All of these indicators would hopefully lead to ultimately eliminating preventable maternal mortality rate. We go to the second pressing health issue. We have noted violence against women. So again, globally, violence against women, particularly intimate partner violence and sexual violence, is a major public health problem and a violation of women's human rights. So WHO estimated that 1 in 3 of women worldwide have been subjected to either physical or sexual intimate partner violence. And we know that violence can negatively affect women's physical, mental, sexual, and reproductive health, and may even increase the risk of acquiring HIV in some settings. But we also know that violence against women is preventable. So in the health sector, we also have an important role to play to provide yung comprehensive healthcare that they need. We go to the third pressing. We have noted the rise in adolescent pregnancy. Globally also, as of 2019, we see adolescents in low and middle income countries like ours, merong a lot of reported adolescent birth rate. And we also know that adolescent mothers, they face higher rates of health issues like eclampsia, systemic infection. And then when teenagers get pregnant, so the body is not yet ready, the time is not yet right, so they are faced with higher risk and low birth weight. And so it affects neonatal also health, neonatal mortality. In the country, although we have noted, based on PSA, decreasing number of adolescent birth rate, but we still have reports of adolescent birth rate, which we need to address. Lastly, we have non-communicable diseases among women. So 2 out of every 3 women die from non-communicable disease globally, they have been the leading cause of death among women for decades, so responsible for 3 in every 4 deaths among women each year. Obesity in women, especially during pregnancy, also contributes to the health risks of their children and amplifies health inequities around across generations. So these are just some of the pressing health issues faced by women today. And with Women's Month celebration, given our year 2023 to 2028 theme, which is to We for Gender Equality and Inclusive Society, this is again, itong campaign natin is both a positive affirmation and a call to action. A call to action for women themselves to participate in the advocacy. And then at the same time also for agencies and institutions to take part at national or local level to ensure that women equal rights and opportunities are provided, are met. So again, women can also participate in trying to address the issues and concerns they face. So this is a good platform for us to remind women and agencies that they can do something about the issues faced by women.
Yes. Thank you very much, Doc, for sharing with us yung ating mga pressing health issues concerning the women, especially ngayon ng Women's Month. And this is, tama po kayo, this is a platform which we can share nga sa ating mga kababaihan to consistently take care of their health at dahil nga dito sa mga nalaman natin on the pressing issues like maternity, especially po sa maternity mortality. And it's good to hear also that the DOH is continuously giving these services for all the women and not for them. Speaking of Women's Month and the theme of Women's Month, that We for Gender Equality, how does gender inequality impact po women's access to healthcare services, and what steps can be taken to address these disparities?
So it's true, no, around the world, women face significant barriers to access timely, adequate, and affordable health screening and care. And as expected, this leads to poor health outcomes and high rates of deaths among women. In some settings, we can observe and see that in some families, they may prioritize healthcare needs of children and men over those of women. And travel time and costs may also make women less likely to access health services. Yung pera ko, itatago ko na lang instead of I will go to the health center to seek help. Women may also have limited financial decision-making power in the household or decision-making power in general. And this significantly impedes their ability to manage their health. Some female-specific conditions such as breast and cervical cancer carry a stigma which acts as a barrier to detection and treatment. So it all affects, sometimes by being a woman, no, marami nagkukos na siya ng barrier sa access sa health services and care. So how do we address this? In the Philippines, World Health Organization first underscored the need to take action to address women's rights to health, including improving social and financial protection system. And an essential element, sabi ni WHO, of social protection is universal healthcare coverage. So we are happy to announce and to remind everybody that in 2009, the Philippine health sector achieved a historic milestone by passing the Universal Healthcare Law. So it's a landmark legislation that guarantees accessibility of quality healthcare for all Filipinos.
Yes, that's true po, no, na just being a woman, talagang maraming barriers in accessing health services, yung mga at ganito. But of course, yung ating government, especially the Department of Health, we have this free services for them. Free po, lalong-lalo na sa ating mga health centers near you. Kaya nga continuous yung ating education, continuous yung ating awareness to the public para po malaman nila that we have this kind of services for them. And na-mention po kanina, Doc, na-mention nyo po yung regarding sa isang pressing health issues din natin is the adolescent pregnancy. So can you discuss po yung importance naman po ng reproductive health education natin and services for women, lalong-lalo na po ngayong buwan ng mga kababaihan?
Okay, so women's reproductive capacity plays an important role in shaping their lives and health. So that's one aspect of our health as a woman that we need to spend time and ensure that we are able to get the services that we need, no, and the information that we need for us to be able to take care of our health. So for all women, it's important that we access accurate information about reproductive health so that we can be able to take care of our health po. We encourage women to consult with healthcare providers in their health centers if they have questions about their reproductive health, whether it be related to their pregnancy or other gynae conditions. Even adolescents, we are also encouraging them to access adolescent-friendly health services from their nearest health center because as early as 10 years old, adolescents already have reproductive issues and concerns, and this should be addressed by healthcare providers who are trained to provide them with the right information.
Thank you po, Doc. Doc, eto naman, no, what are the common misconceptions? Yung common misconceptions, stigma surrounding women's health that need to be addressed, and how can Women's Month serve as an opportunity to challenge these misconceptions? Okay.
We are grateful to our OB-GYN consultants who helped us identify some of these myths that really they have an experience with patients, no? So some of these myths that they have which actually cause or impose a great deal of mental stress and fear and leads them to poor health-seeking behavior. We have like, for example, tubal ligation, that it will make the woman promiscuous. So it affects their knowledge or their ability to choose a right FP method for them to use. No, you can work hard or carry heavy objects if you have tubal ligation or IUD. You can't get pregnant while breastfeeding, even if beyond 6 months or if with no resumption of mensen. So this is related to prevention of ensuring that there's proper spacing between your pregnancy. No, cancer isn't preventable. So maybe some women have misconceptions revolving around breast and cervical or ovarian cancer, that they say it's only related to genetics. Although genetics play a role in your likelihood to develop cancer, there are also lifestyle factors that may play a role. And what is important is for women to remember that it's possible to also prevent cancer prevent the progression of cancer by early detection. So consultation is important. Early consult is or screening is important. Girls don't need to see an OB/GYN until adulthood. So as mentioned previously, a while ago, that as early as adolescence, you can already seek guidance from your medical doctor or healthcare provider when you are going through some reproductive changes in your body as adolescents. Yeah.
Yun po yung mga na-share ni Doc, no, na mga common misconceptions lang and stigmas ng mga kababaihan. So maybe let's be aware of that, and let's clarify it from the medical experts talaga para we can clarify at hindi po tayo magkaroon ng mga misconceptions at matakot, no, na wala naman pong proof, no, not proven by a medical expert. Doc, what are some preventive measures naman and lifestyle choices that women can make to promote their overall health and reduce the risk of diseases such as breast cancer, cervical cancer, and heart diseases?
Okay, I think so the Department of Health promotes healthy lifestyle, no? So we have like our promotion on no smoking. That's for general public, no? But we are also promoting the use of HPV vaccination, the vaccination against human papillomavirus. These are provided to adolescents, as early as adolescents, for the prevention of cervical cancer. We hope that mothers will be able to guide their adolescents and allow their adolescents to be immunized by this vaccine. We also have, of course, generally we are promoting that women and the general population will eat nutritious food, they will do regular exercise, and then for prevention of breast cancer, the regular or annual self-breast examination, and then the voluntary submission for screening on cervical cancer, like visual inspection with acetic acid and pap smear. And then aside from immunization and exercise, healthy diet, I think also for early consultation or early check-up with their medical provider.
Thank you very much po, Doc, for that tip, no, and advice for our women or women's sector po dito sa ating community. Doc, lastly na lang, as a woman and as yun po ngayong Women's Month celebration, what is your message to all the women, mothers po na nanonood sa atin ngayon, especially in terms of their health and well-being?
As we celebrate our National Women's Month, we ponder on, we reflect on the theme of really equality and inclusion. So we'd like to remind everybody that as an individual, you have a role to play by merely advocating for healthy practices and merely sharing knowledge on or information, accurate information about diseases affecting women can also help. As an organization, we have that responsibility also to ensure that women are included in decision making and that they play a role, even themselves, they play a role in advocating for good health among them. Women can also help women and girls to make informed decisions about their health. So as healthcare workers, we have that opportunity to provide health education to women so that they can make good decisions for their health also. Every woman and girl should be able to enjoy their full potential and express freely without biases, and express freely their thoughts and their beliefs, especially regarding health. My encouragement is that they will be able to find true or correct information from also reliable sources like the Department of Health or other approved sites in the social media, if they fond of using social media. We are promoting equal access to health services, and with universal health care, it is important for all of us to work together because bawat buhay ay mahalaga at bawat Pilipino dapat ramdam ang kalusugan. Thank you po.
Thank you very much po, Doc Cheng, for sharing that with us. Talaga naman nakaka-inspire, no? Tayo pong mga kababaihan ay mag-celebrate po ngayong buwan ng Marso because this month is for us, no? Tayong mga kababaihan. Tayo po ay malakas, no? Pero mahalaga po na tayo rin po ay healthy. So let's maintain our health and well-being po. Gaya po ng nasabi kanina or na-share sa atin kanina ni Doc Cheryl Sarmiento. Once again, maraming salamat po sa Department of Health for being with here sa amin po dito ngayon sa ating programa. Talagang siksik po yung ating programa ngayon na pag-usapan po natin ang patungkol sa World Tuberculosis Day and syempre rin po ang pagpapahalaga ng women's health ngayon pong buwan ng Women's Month. So maraming salamat po sa lahat po ng ating naging panauhin ngayong araw. Once again, Doc Cheryl Sarmiento, Medical Officer po ng Department of Health in Region 9. At maraming salamat po muli sa lahat po ng ating mga viewers. Naway marami po tayong natutunan ngayong araw sa ating episode mula po sa Department of Health. Thank you very much then once again sa ating mga sponsors. We have Dunkin, Blanca Kalintika Estetica Zamboanga, Karimadon, Camiseta, and Penguin, all available here at SM City Minpro. Once again po sa ngalan ng Philippine Information Agency Director General Jose Torres and Regional Director Ms. Noemi Edaga, ito si Myra Espinosa at magkita-kita pa po tayo sa mga susunod na episodes ng Kapihan na Zamboanga. Muchísimas gracias.